Brigatinib is a next-generation tyrosine kinase inhibitor that was designed to have a very wide spectrum of activity, not just against the wild-type ALK fusion, but also against many different resistance mutations that might emerge with prior therapy. The drug was previously approved for ALK-rearranged lung cancers who had progressed on crizotinib, the prior standard of care, or who for some reason were intolerant of crizotinib. Now, however, with the ALTA-1L trial, this asked the question, is brigatinib better than the prior standard of care crizotinib? And so patients with ALK fusion-positive lung cancers were randomized to brigatinib or crizotinib. And no surprise, because this was a drug that was designed with a much wider spectrum of activity, as mentioned, and also with meaningful CNS activity. We saw that the trial was positive, meaning there was a substantial difference or improvement in the progression-free survival compared to crizotinib. We don't generally look for an improvement in objective response rate because they're in the same ballpark for these TKIs, but certainly what we value when choosing a newer drug over a prior standard of care is seeing whether or not it prolongs disease control, and certainly we saw that. And finally, we also saw that the drug did have meaningful activity in the central nervous system, and if you look at the curves of intracranial PFS, we saw that these diverged for crizotinib and brigatinib. So I think this was very exciting data that established that in comparison to the old standard of care crizotinib, that we were seeing substantial differences with this next generation drug.